But tonight, our special focus is on what we are calling the Doctors Roundtable. Remember, tomorrow India embarks on V-Day, Vaccination Day. The world's biggest vaccination drive on coronavirus begins tomorrow with healthcare workers who've been on the front line ever since coronavirus gripped the country, being the first to take the shots at the vaccine. Starting tomorrow and over the next few weeks, around 1 crore healthcare workers are expected to get vaccinated. 3 lakh healthcare workers are expected to get the shots on day 1. In a moment, we'll be joined by top doctors from across the country on what lies ahead. It's our top story today.
1 year of complete dedication, 0 vacations, busy work hours. After leading the war on the invisible enemy, a virus the size of 100 nanometers, 1 crore health workers will take the shot in the first phase of the world's biggest vaccine drive in India. Dr. Pragya Shukla, one such corona warrior who was on the front lines, sees light at the end of the tunnel. She has decided to take the first shot of vaccine to not just set an example for her colleagues, but also to reassure them.
मैंने ये वॉलंटियर किया है ये अपने इंस्टीट्यूट का फर्स्ट वैक्सीन शॉट लेने का और जो उसके पीछे रीज़न है वो ये है कि अगर मैं लूँगी तो मैं अपने स्टाफ में एक बहुत ही क्लियर मैसेज दे पाऊंगी कि ये सेफ है और ये लिया जा सकता है, इसमें डरने की कोई ज़रूरत नहीं है.
Many have fears. It's a new vaccine. Will there be side effects?
इस वैक्सीन के बारे में मैंने अभी ट्राई नहीं किया, मैं अपने ऊपर ट्राई करवाऊंगी समय पहले ताकि वो लोगों का डर भी निकले इस चीज से.
The vaccination drive will begin at 3,006 sites across the country on Saturday. On the very first day, 3 lakh health workers will get free shots. Each vaccine center will inoculate 100 people a day.
कल तो लॉन्च है, तो कल हम लोग उम्मीद कर रहे हैं कि 100 बेनिफिशियरीज़ को वैक्सीन लगाई जाएगी. बट आगे आने वाले दिनों में हमारी कैपेसिटी है कि हम एक दिन में लगभग 3-3.5 हज़ार लोगों को वैक्सीन लगाएं. तो उसके लिए तैयारियां चल रही हैं. हम 34 वैक्सीनेशन साइट्स डेवलप कर रहे हैं. बिकॉज एक बिल्डिंग में 34 साइट्स होनी है तो हमारे साइनेजेस बहुत अच्छे तरीके से डिस्प्लेड होने चाहिए. तो उसी के लिए हम लोग साइनेज सब किस साइट के ऊपर कौन सा साइनेज है, किसको कहाँ बैठना है, कौन कहाँ से आएगा, उसके लिए तैयारी की जा रही है.
Tomorrow being the first day of immunization, throughout the Telangana, we selected 30 candidates at each site. So, like that, in Gandhi, we are prepared to give immunization for 30 beneficiaries. So, we are having 3,000 beneficiaries. So, actually, Gandhi is having 7 sites. So, each site can immunize 100 people. So, like that, 700 per day.
The government will look at a large inoculation drive, and the CoWIN app will also play a very, very important role. For now, the healthcare workers are the only ones getting vaccinated, and no one is allowed to cut line and get in between. That is something that India has been waiting for. And finally, we have approached V-Day. With Pradeep Gupta, this is Milan Sharma for India Today.
Okay, so let's kick off V-Day with our Doctors Roundtable. I'm joined by some of the country's top doctors today from different parts of the country. Dr. Ashok Seth, Chairman Fortis Escorts Heart Institute, joins me. Dr. H. Sudarshan Balal is Chairman Manipal Hospitals from Bengaluru, joins me. Dr. Kunal Sarkar is Senior Vice Chairman Medica Super Specialty Hospital in Kolkata. Dr. Hemant Thakkar is one of the country's leading physicians in Mumbai. And Dr. Subramaniam Swaminathan, Director Infectious Diseases, Gleneagles Global Hospital, is joining me from Hyderabad. And I'm also joined by Sanjeev Agarwal, founder Good Governance, and he's going to give us a slightly different perspective, and we'll tell you in a moment why. But before that, I want to ask each of you doctors, if I may, to raise your hands if any of you are planning to take the vaccination in the next 1 week. If you are given an option, how many of you gentlemen doctors would take the vaccination? Could you raise your hands? How many of you would take the vaccination if you were given the chance? Okay, there I've got a couple of around 3 or 4 raised hands out of 5. Okay, Dr. Thakkar, why don't I start with you? Because as a physician, you can give us a sense. You put up your hand saying if you were given the chance, you will take the vaccination. Presumably, you will be in line to take one. Is it completely safe in your view? Is it the advisable thing for all health workers to do?
Definitely, because the vaccine is going to afford me a degree of protection, much more than what I will get whilst I wear the mask and I sanitize myself. I'm exposed every day to COVID patients and I go to hospitals. And by using either of these vaccines, I'm definitely going to get a degree of protection, which will allow me to form antibodies in a very definite way. So I would definitely go for the vaccine. And these vaccines are time tested because the method that they have employed, the Indian 2 vaccines, are both time tested vaccines and they are not the new mRNA vaccines. So I would go for the vaccine.
But are you guaranteed immunity? Does that mean, for example, that you will stop wearing a mask, you will not do social distancing, because there is still there is a lack of clarity over immunity that the vaccine will confer?
So I must be very clear, loud and clear on the largest channel here, that even after vaccination, you have to keep wearing a mask. 2021 is going to be a masked year also. You must have social distancing. Just because you have the vaccine doesn't mean you throw caution to the winds. You are going to get a degree of immunity depending on your immune system and depending on which vaccine dose you take second. And depending on which vaccine you have chosen, anything from 70% upwards after the second dose is guaranteed to you. So 70% upwards in an increasingly vaccinated population is heading towards a significant amount of protection, which will finally lead to herd immunity. So there are no two things about that. Nobody should take the vaccination with the aim of throwing the mask away or not having COVID appropriate behavior. I'm very clear on that.
Okay, let me therefore take that to Dr. Seth, because Dr. Seth, there will be those who will say, you also raised your hand saying you'll take the vaccine, but if you have to continue with all the other COVID protocol, to that extent, what benefit will the vaccine confer is a question that many are asking.
So there are two aspects to it. One is your own personal immunity, which is not guaranteed, which you just heard, is 70 to 90% efficacious. But what it therefore does, we must remember, is that it can convert a severe infection to a mild infection. And you may also not be able to infect others, though you may get infected yourself. Now, we must remember that till corona goes away, and that is by a herd immunity, it is not just your own personal self you're responsible for, but the more people who develop antibodies, either through natural methodologies of infection or through the vaccination methodology, which is the safer of the lot, you get to the herd immunity where the virus cannot therefore perpetuate itself or live in an environment where everybody is immune and therefore dies away. Till that time happens, until a majority of the population gets inoculated or vaccinated and develop antibodies, we have to continue the precautions that we are actually stating for three reasons. Firstly, the fact that it doesn't guarantee you 100% immunity, it's only 70 to 90% and will only drive the virus out over a period of 2.5 to 3 years. Secondly, that mutations of the virus may come in, and there can be nothing better than a social vaccine to continue the very precautions that we've understood well, at least for the next 1 or 2 years.
Right.
And finally, till the herd immunity comes in, we have to have that with us. And by the way, we've not learned bad things. We've actually learned good things. Finally, hand hygiene has to be emphasized again and again as a part of living, not necessarily as a part of just from, yourself from the virus.
Point taken.
Touching each other is never been, we've always been taught this, we've always been taught this, we've always been taught Sat Sri Akal. But where did the handshake come from? So I think overall, we've actually been more cultural, we've learned the right hygiene, and we've learned to live slightly better and more hygienically, should we say.
So both my doctors saying that, COVID protocols continue even as you get yourself vaccinated. Dr. Balal, Chairman Manipal Hospitals, you run one of the largest hospital chains. Are you going to make it mandatory for all the doctors in your hospitals to take the vaccine? Because remember, that this vaccine is not necessarily mandatory, nor do you have a choice of which vaccine you will get, whether it's Covaxin or Covishield. In your view, should all your doctors take it? Are you going to make it mandatory for all the health workers, nurses, doctors in your hospitals to take the vaccine?
At the outset, thank you for having me here, Rajdeep. We have been badly bruised and battered by COVID for a year, and finally we have some light at the end of the tunnel. I would wish to make it mandatory for every healthcare personnel, but we live in a democracy, so we cannot impose our views. But I would strongly, strongly urge all my colleagues to take the vaccine. However, it's still a voluntary effort, and people can refuse the vaccine, but I would urge them not to do that, because this is certainly an additional safety in addition to the social distancing, masks and hand hygiene. So we shouldn't let go of this opportunity. We need to fight COVID together, and we need the cooperation of the citizens of this country, because it's not only you who are affected, but it's the society that's affected. So we need to get rid of the scourge with all the measures we have, and certainly, in my opinion, the vaccine has been a godsend.
So you're saying that you're not making it mandatory for all the health workers in your hospital, but you would urge them to take it. Am I correct?
Yes, I don't think we have the powers to make it mandatory.
And you don't see any difference between Covishield and Covaxin?
Really not of any substance. Whichever vaccine is offered, I would take it.
Okay, whichever vaccine you're offered, you'll take it. Dr. Kunal Sarkar, Senior Vice Chairman at Medica Super Specialty in Kolkata. Will you take the vaccine, and do you believe that the vaccine is a step forward?
Rajdeep, we for once, after we have been bullied by the virus for a good part of 5 to 6 months, we must realize that we are the only major country in the world which is getting an opportunity to vaccinate at the declining phase of the pandemic. This privilege of fate has not been imparted upon any second country in the world. Look at what's happening in Europe. Look what's happening in the United States. They are running helter-skelter between treatment, exhausting healthcare capacity, and vaccination, which is an impossible task. So India has to make most of this opportunity. But to make vaccination meaningful, it has to be put in the capacity context. After we kickstart tomorrow, fair enough, it is an emotional day, healthcare workers will be vaccinated, everything fair enough. But I've been hearing a figure that we will vaccinate at the rate of about 10 lakhs per day. At 10 lakhs per day, it takes about 5 years to immunize the target population of India. So we are not just talking about vaccinating the healthcare workers, we are talking about vaccinating the country. So after the sort of emotions, the symbolicism runs out, India's got to talk seriously about speed and capacity. Because once again, we are the only major country in the world who's getting an opportunity to vaccinate at the declining phase of the pandemic.
You make a very important point that we are vaccinating at a declining phase of the pandemic, and I'm going to come to capacity building in a moment. Dr. Subramaniam Swaminathan, Director, Infectious Diseases at Gleneagles Global Hospital, why don't you also weigh in? Do you believe that the vaccinations as they are kicking off tomorrow are a step in the right direction, and it should be mandatory in a way for all health workers in the initial phase?
This is an inevitable step. I don't think we can make it compulsory or mandated, because there is no such proviso even in the Western world. For example, the closest we have to an occupational vaccine is the flu vaccine. And in the Western world, they make it very, very painful to the healthcare worker not to take the flu vaccine. So any healthcare worker not opting out of the flu vaccine is expected to wear a mask continuously during the period that he's inside the campus of any healthcare system. So given that it's so painful to adhere to that kind of a regulation, most healthcare workers just opt to go for the vaccine itself. I think that's the only way we can make healthcare workers take the vaccine. The important thing here is that most healthcare workers are not upset about taking it. In discussion with my own colleagues, what I've realized is they want to see more data. And the one thing where I think we have slipped is basically this whole exercise has not been preceded by an aggressive education campaign about how this vaccine is going to be rolled out, and more importantly, the dynamics of the vaccine, how it interacts with the immune system, what exactly are the parameters of protection, who should and who should not be vaccinated. we're going to have a young labor force which is going to get vaccinated. A lot of women in the reproductive age group who may be pregnant or could become pregnant. What about them? These kind of answers should have been thought of earlier and discussed in advance so that people will be more comfortable with the idea of vaccination. Please understand they still want it.
Right. You have two important elements coming in. One is capacity building and one is data. Do we have enough data to justify this kind of a mass vaccination campaign? A good point on which to come to you, Sanjeev Agarwal, because you have a slightly different perspective. You're founder Good Governance India, and you've written an important article saying majority Indians have natural immunity. Vaccinating the entire population can cause great harm. Are you suggesting that the vaccination program should be more targeted? The one that starts tomorrow shouldn't just be an omnibus program, it should be much more targeted.
Absolutely. The reason is, I hope all of my co-panelists from medical profession would agree that half of us have had it. More than half of us have had it without knowing it. And so we have natural antibodies. You see, the sero surveys conducted by various bodies and mathematical modeling, and ThyroCare, who has done commercially probably the largest number of tests in the world, checking the antibodies in the world. They figured out that more than half the Indian population, in fact, ThyroCare would suggest that 100 crores, 70% Indians already have antibodies. So if we have antibodies, those who have antibodies do not necessarily require vaccination because they are immune to the extent a vaccine at this stage provides immunity.
So
probably better off.
So you're calling for a more targeted vaccination program for those who do not have antibodies, those who've already been COVID infected, or those who, in your view, is proven to have the antibodies should not be taking the vaccinations. Am I correct?
That would be logical because of many reasons. Firstly, the supply side, it's quite limited. Secondly, there can be downside in, very limited downside in vaccination. So, if I don't have to take it, why should I take it? And so let's not forget it is emergency use authorization. These are very safe. We should not fear it. If I don't have antibodies and I am vulnerable in the sense that I'm a part of medical professional, I'm a profession, I'm a frontline worker, or I'm very old, let's say more than 60 or 65 or 70 years, then I should take it. But if I have antibodies, even if I'm vulnerable, I should let others take it.
Okay, that's an important element that I want to come to you, Dr. Thakkar, because starting tomorrow, the government is going on what seems to be the first step towards a mass vaccination program. Should it be better targeted? Should this program, as has been suggested earlier by one of the doctors, Dr. Swaminathan, that you need better data, and that in the absence of data, there are doctors out there who are wary of taking the vaccination.
So let's be quite honest. This is emergency approval, and this emergency approval is all over the world, whether it's Pfizer, Moderna, Astra, Covaxin, Covishield, and this emergency approval is because of the pandemic times. And if we do not use this window of opportunity to vaccinate people with this emergency approval and we wait for data, see, traditionally vaccines have been perfected and have been brought into the world after 5 to 7 years of clinical research. That would be waiting too long. So you have to choose between the lesser of the two evils. And if you have adequate, now I agree Covishield's phase 3 data from India is still being processed. But 5-6 countries all over the world have used the Covishield vaccine, Astra's vaccine, and we have data from Brazil, UK, South Africa, etc. Similarly, Covaxin is also getting its data into shape. So while I agree that consciously, science-wise, you want to wait for data, and therefore it's not mandatory, you can do what you wish. Regarding this other point about antibodies, I agree that somebody who has had documented COVID could defer his vaccination. He needs vaccination. but he could defer it and opt out to give it to somebody who has not had documented
No, are you
COVID.
saying he still needs it, Dr. Thakkar, that even if I have documented COVID, I'm a nurse or a doctor who's had COVID, I still need the vaccination?
Yes, for the simple reason the vaccination will provide B cell and T cell immunity in a longer lasting way. And the universal consensus now is that even those who have had COVID, one does not know the life of the antibodies generated following a COVID infection. So at least those people, they could defer it and opt out for the others. But I'm not in favor of getting people to do their antibodies before giving the vaccination, because it's a cumbersome, expensive, time-consuming procedure. But if you have had documented COVID, then you can opt out and defer it.
But doctor, I don't know, Dr. Thakkar, for example, how long my immunity will last at the moment. Suppose I take my first vaccination tomorrow and the second after 3 weeks or 4 weeks. Do I know how long my immunity will last?
So the immunity data which we have for the present is that at least for 8 to 9 months, your immunity will last, because you will have a T cell and a B cell response. And if you take the second dose a little later, especially the Covishield, as they've said, instead of 28 days, if you take it after 6 weeks, right up to even 90 days, you will get a bigger and a better response. But you need the vaccination even if you have had COVID of any degree. Now, if you have had recent COVID and if you have been given plasma and all these other drugs, you might defer it. If you want to be a valiant warrior, you might say, I'll take it after 4 weeks. But you need it, and maybe in times to come, maybe after 2 years, we'll need a booster dose. Who knows? This is a new virus. It's 1 year old. But you need it, and it will protect you surely. If it doesn't fully protect you, the infection that you will get will be a tempered infection. It will be a mild infection. So vaccination will always offer a degree of total, if not total, partial protection, which is desirable.
Dr. Seth, have you been able to convince your staff around the lines of what Dr. Thakkar has suggested, that it will provide some kind of immunity, therefore you need to take the vaccine? Would you say a majority of health workers across your hospital chain are more than willing to take the vaccine starting tomorrow?
So let me just address two issues, and I just wanted to put the previous comments into perspective. And I think it's very important, Rajdeep, to put that into perspective, saying, should it be targeted versus everyone? The importance of realizing is that you may get COVID, but you have a variable response and antibody response to COVID, depending upon the dose of the virus that you actually acquired. And that's why you see various illnesses and various responses, antibody responses. What's different when you get vaccinated, it's a fixed dose. It's a predictable response unless you actually have some immunological illness. And there's a booster dose, which therefore gives a long-lasting response. The second aspect, which has been discussed by every country, and by the way, this point has been discussed every country, that should you be vaccinating those who've already had COVID? It's clearly understood that if you test everybody for antibodies, that's more time-consuming, that's more expensive, and that doesn't get people vaccinated. And therefore, it is clear that testing antibodies and then vaccinating is of no use because of the two reasons which I have clearly outlined, and every country now accepts that and moves ahead.
But
thirdly, there's a uniform...
yeah, go ahead. Sorry, doctor. Go ahead.
Thirdly, that there's a uniform pattern to everything that you do. Yes, I agree with Dr. Thakkar that people can opt out. Those who have recent COVID may want to get it 8 weeks later, 12 weeks later. 4 weeks is anyway the minimum time that they can't have it. But they may want to get it 12 weeks later. They opt out and they can actually give it to somebody else takes it. The second aspect you asked was, is there a concern amongst the healthcare workers? And I would say it's natural. By the way, it's voluntary. It's natural to have concerns, but it's also a responsibility, just like we're doing on this channel of yours, to allay those concerns, to take away the misinformation, and to provide the confidence and the comfort on science, technology, and research in our own country. I must say that very clearly, that today, while we have discussed whether we got phase 3 or haven't got phase 3, one thing that the expert committee and the government has done, made sure that the vaccine is safe and the vaccine has quality.
Okay.
Now, the efficacy issue and the phase 3 will come. But if the antibody responses have been there, and by the way, Oxford, the data predominantly exists of the Western countries. Only 1,600 patients were from India. Covaxin probably now has 23,000 patients, and the trial would be over in 4 weeks' time. What I'm saying is that we have to have confidence. I'm not at all worried whether I get vaccine Covishield or Covaxin. Sitting here, I can say I'm not even going to ask that. And I'm saying that everybody should gradually, those who are concerned, it's for us to allay those fears, but they will also gradually see that people are benefiting, that the side effects which everyone's worried about, and by the way, even a paracetamol tablet has 2 pages worth of side effects attached to it, and we take it, and perhaps thousands and thousands of people take it every day, are only mild and those of fever and perhaps ache in the arm, which actually happens with every injection.
Okay, point
so
taken.
I think
So
gradually people will transform into accepting the vaccination as a norm,
that is very
but not just
reassuring.
as a norm, as a responsibility. As a responsibility to every person in this country.
That's very reassuring, Doctor. I just want to understand, though, Dr. Balal, in terms of sequencing, in your hospitals, is there a sequencing that you've gone that the more elderly among your doctors or health workers get it first and then the younger doctors? Is there a sequencing that you intend to do?
No, there's no sequencing. What we will be doing is we have 4,000 plus employees registered in our main hospital. And as per the rules of the government, we are going to set up about 42 centers or 42 booths so that we can cover about 100 patients a day, which would cover almost our entire staffing in about a day. But there won't be any preference for young, old, ladies, men, nothing. It will be according to the booths that you're allocated in. There may be a booth for doctors, one for nurses, one for paramedical personnel, but that will be the only differentiation. And that's a matter of logistics, not really a preference to anyone or not. One more thing I'd like to say, Rajdeep, as much as we respect everyone's opinion, I do believe that people should be vaccinated, irrespective of whether they've had COVID or not. It would be almost impossible to check everyone for a COVID antibody. I have seen hundreds of patients who have had COVID and the antibodies just disappear, and we cannot do complex T-cell immunity tests. So I think in a mass campaign like this, it would be impossible and maybe a waste of money and energy and losing your focus if you try to do an antibody test and then selectively vaccinate someone who does not have the antibodies. Please vaccinate everyone. The government has taken the right policy and we should go.
Dr. Sarkar, do you also agree the policy that the government has taken is step by step, health workers first, then the other frontline workers, then you go to the elderly, and then you move to those with comorbidity? The sequencing is important in your view, Dr. Sarkar?
Yeah, of course it is. Of course it is, Rajdeep. But I think even within healthcare, we have to prioritize people with their chances or the probability of getting exposed. So without a doubt, people who work in critical care, anesthesia, invasive specialties, who are coming into close, intimate contact with patients, all kinds of healthcare workers will have to be given preference, and the rest will follow. Because, today is also a day when we remember more than 1,000 odd healthcare workers, which includes more than 500 doctors who have fallen to this pandemic. So I think preference will have to be have scaled depending upon the probability of getting exposed. These people will have to get vaccinated first. Right. And if I may, Dr. Agarwal made a very important point, but perhaps in this huge mass of data that we have, one data that is missing, which we only have in patches, which is a formative sero survey of India. Because a substantial, robust sero survey to give us an insight, yes, from Dr. Agarwal said, we do believe that we have a detected to incipient ratio of 50:1, which makes about half the country affected. But a lot of that is based on presumption and very small sample sizes. So probably that is right. But by this time, we would have expected our ICMR and other authorities.
But I'm getting a sense that irrespective of the Sero survey data, most of you are saying we must still go ahead with the vaccination drive. Dr. Subramaniam Swaminathan, in a sense, therefore, even though, as you said, some of your colleagues have misgivings in your hospital about the data available on the vaccination, the sense one is getting is that given all that has happened over the last 9 months, is seen as a step forward in at least restoring confidence among health workers on the front line.
Absolutely. See, the concept of vaccination is not being debated at all. Everybody agrees that a good vaccine is the best weapon in our armamentarium to keep us safe. And like everybody has said, looking at antibodies does not necessarily make sense because B-cell immunity, which is antibody, which will wane over time, is not a very good protection. As somebody said, it's going to take a long time for us to vaccinate everybody. So even those who have antibodies only and no T-cell immunity will become vulnerable even before the exercise is over. So for that reason, we need to have a system by which even the T-cell is challenged. And to me, the vaccine makes more sense. So therefore, I don't think there's a question of looking at antibodies at all. We just need to go ahead and vaccinate everybody. But the concern is that how do we make it acceptable to everybody? Like somebody has pointed out, there's already a lot of data. If you look at what every country has done, when they rolled out the vaccination campaign, they succinctly summarized all the data that's available to date and put it in a way that people can easily understand. And I think that's where we missed a trick. We should have collated all the data from all the centers that have used any of these vaccines and said, see, this is the number of people who have been vaccinated, these are the kind of side effects we have seen, and this is how safe it is. That would have made for a huge soundbite as compared to the deafening silence that we are hearing right now. The second thing I would definitely encourage is to have our first citizens being vaccinated first. If you look at what happens in the Western world, the first people to get the vaccine are always the heads of state. I think people seeing them would make a huge difference in their morale and their confidence in the program as compared to just rolling it out everywhere.
You know, yes, Dr. Swaminathan, what you seem to be suggesting is that Prime Minister Narendra Modi, who's launching this virtually, should take the first vaccination. Is that what you're saying? It's happened in a few other countries. I know other heads of state who've done it first. Are you telling us that the Prime Minister should be taking it first?
Why not? I think he should lead by example. See, I believe in the vaccine. I'm sure he does too. So let's lead by example. Let the whole world see, not just India, let the whole world see that we back what we say and we believe in the vaccine. Because I think it's important for people to see that. And seeing such important people taking the vaccine will immediately improve the morale and the confidence in the product. I think it's absolutely necessary, and this is what the Western world has done.
No, tomorrow there'll be someone who will say it's a VVIP privilege, that, you know, the VVIPs are getting it first. That's the flip side of it. If the Prime Minister takes it first tomorrow...
I will explain.
Yes.
No. Please understand that senior administrators who are in key functionaries are considered very, very important and vulnerable because that can cause a lot of civil unrest and chaos if they are not protected. See, please understand, key functionaries are just as important. Why are sanitary workers less important? Why are people who are in law and order less important? All of these people are important. And I think building up morale and building up confidence in the product is just as important, because if we are going to lose people due to loss of confidence, that is also going to come back to hurt us.
You've triggered a debate point. I don't know whether there's an alternative view out there somewhere. Should the Prime Minister be taking the first vaccination to build morale, is what Dr. Swaminathan is suggesting. Dr. Thakkar, you agree with that? Should the Prime Minister take the first vaccination? Is it important to build morale, to build confidence?
I think doctors themselves, when they go forward and take the jab, all the patients and the community believe in the doctors as they believe in their politicians. So if they need evidence that we are walking the talk, and like all of us raised our hands and we said we'll take the shot. So if one of us takes the shot and my innumerable patients see me taking the shot, that also gives a lot of confidence. Remember, every person has a medical history, and it is his privilege to decide when he wants to take the vaccine, if he wants to take the vaccine. So I am nobody to say who should take the vaccine and lead by example, but I am certainly there to say that if health workers willingly, and that also heads of department and doctors in practice like all my colleagues and me, if we went up and we took the vaccine, then all the workers in our hospital would definitely generate and get inspiration and have confidence. So I would do that.
Mr. Agarwal, do you believe that the vulnerable should be taking it first, or do you believe, as is being suggested by Dr. Swaminathan, that it should be taken first by the VVIPs so that they can inspire others to take it?
Well, first of all, I want to clarify I am pro-vaccine. I think it's a privilege at this stage, So, so my concern is only a constraint from supply side and a constraint in administration, as Dr. Kunal Sarkar rightly pointed out, that it will take 5 years to vaccinate all. So, our goal now is to build up herd immunity. I don't think there is a lack of confidence problem like in Western country. We'll have more demand than the supply, and we will have to ration as we are having to probably.
Okay.
And so in that, I think this question is not that relevant. That look, we don't have a confidence problem. We have a supply problem. And if that's why we believe that.
So in a supply problem, you've got to go to those who need it most first, right? That's what you're trying to say.
Absolutely.
That's your point.
And those who have had it, they don't need it. Right. And in our view, if it is administered after checking antibodies, we can create a herd immunity. We are near herd immunity.
Okay,
that's what we are claiming based on data available.
Dr.
So
Sarkar,
within a month or two,
Dr. Sarkar, you wanted to make a point. Go ahead, Dr. Sarkar.
On a lighter note, on the theme of vaccination, there is a mystery in the world, and that is called the mystery of Putin's daughter. Because if you would remember, Putin, in a very much publicized way, his daughter received the first vaccination, and there was a bad week in Moscow when a lot of side effects of the Sputnik got reported, and then the news agencies came out saying that it wasn't actually Putin's daughter. So whatever, I think this Putin's daughter kind of controversy is best avoided, and I think I quite agree with Dr. Thakkar that if doctors come out and receive the jab first, that will be good enough.
Dr. Seth? Is that where you also stand? It doesn't require the Prime Minister to take the first jab. As long as all of you who are heads of hospitals take it, all the health workers will be inspired to do so.
Absolutely. The medical healthcare professionals, the healthcare workers are the icons of today. We must not forget the last 10 years, they've sacrificed every moment of their lives in taking care of ill COVID patients. They're the first ones who are actually going to take the jab and be iconic in creating the confidence within the country that if they could take it, if the heads of hospital could take it, if every healthcare worker came forward to say, here's my jab, that's a privilege and a prestige for the nation that we are taking care of you and we're protecting you. It's not because I wanted to protect myself, it's because I wanted to protect you all as well.
Okay.
That, I think, is the biggest confidence that we can create. So we're privileged in a way that the healthcare workers, the frontline workers, are the first to get it because they can be iconic for the rest of the country.
Let's leave it there. I'm sure that come tomorrow, some of you will start taking the jabs, and we look forward to even those over the age of 50 like me being in the next round, as we are told.
I'm looking forward to it.
Yeah, we're all looking forward to it. In a way, the very fact that we are smiling about what's been a traumatic period of otherwise over the last 10 months suggests that the very prospect of a vaccine is giving people a sense of confidence that maybe the worst is over. Thank you all very much for joining us. It's always a privilege to be talking to doctors because you give a sense of reassurance and confidence to all of us. Thank you. Thank you very much.
Thank you. Thank you, Rajdeep.
Let's take a break at this point because we're also going to look at the challenges being faced by our administrators. Remember, it's the health ministers and the health administration of different state governments that will be on test starting tomorrow. We'll be joined by the health ministers of two key states, Delhi and Maharashtra. Will join us on the other side. You're watching the news today. News, as always, without the noise. Back in a moment. Welcome back. The countdown to V-Day or Vaccination Day starts on Saturday tomorrow. On your screen now, visuals of the preparations that are going on nationwide for the vaccination program that will be launched virtually tomorrow by Prime Minister Modi at 10:30 a.m. Over 3,000 sites across all states to be connected during the launch. And remember, the focus in this first round will be on health workers, around 100 beneficiaries or health workers to be vaccinated at each site on this day. After health workers, frontline workers to also be part of this first phase of the vaccination. So a lot of the health ministers and members from different parts of the country are health administrations on test. I'm joined by some of them. Satyendra Jain, Delhi's health minister, is joining me. I'm also joined by Rajesh Tope, Maharashtra's health minister, joins me from, and I'm joined by J. Radhakrishnan, Tamil Nadu's health secretary. Appreciate all of you joining us on the show. Satyendra Jain ji, let me start with you in the national capital. The government, I'm told, of Delhi is promising in any case free vaccinations to all. दुनिया का सबसे बड़ा vaccination drive कल से शुरू हो रहा है. क्या आप पूरी तरह से तैयार हैं? All systems go for tomorrow?
हाँ बिल्कुल, दिल्ली की तैयारियां बिल्कुल दुरुस्त हैं. हम दिल्ली के अंदर कल 81 साइट्स पर इसको स्टार्ट करेंगे, जिसमें सरकारी भी और प्राइवेट भी दोनों तरह के हॉस्पिटल्स हैं ज़्यादातर, और एक सेंटर पर 100 लोगों को इसमें वैक्सीन लगाई जाएगी.
ये कहा जा रहा है कि अगर किसी को वैक्सीनेशन के बाद साइड इफेक्ट्स हो, अगर हो, तो क्या पूरी तैयारी है उस प्रॉब्लम को निपटाने के लिए? पूरी तरह से बंदोबस्त है?
जितनी भी हमारी लोकेशंस हैं, जितनी भी हमारी साइट्स हैं, सभी साइट्स के ऊपर हमने स्टैंडिंग इंस्ट्रक्शंस हैं कि एडवर्स इवेंट्स के हालात के अंदर उसको किस तरह से निपटा जाए, और सभी जो भी लोग वैक्सीन लगवाएंगे उनको वैक्सीन लगवाने के बाद 30 मिनट्स तक ऑब्जर्वेशन में वहीं पर रखा जाएगा. देखिएगा, बहुत ही रेयर चांस होते हैं किसी तरह का एडवर्स रिएक्शन हो, पर फिर भी बहुत ही एहतियात के तौर पर अबेंडेंट कॉशन की तरह से हम 30 मिनट्स के लिए वहीं पर उसको रखेंगे, ताकि कोई भी बात होती है तो उसको वहाँ पे डील किया जा सके.
Okay, let's start from Delhi to Maharashtra, because remember, Maharashtra, Mumbai has been the worst affected by COVID. Mr. Tope, Health Minister Maharashtra, fully geared up for the vaccination distribution. I'm told that Uddhav Thackeray ji is launching it at 11:15 a.m. tomorrow, but fully prepared Maharashtra, given the scale of what is required in a much larger state like that?
Surely, this is Maharashtra is very well prepared. Like, we are planning of 511 centers. In each of the center, we are planning to vaccinate 100 people. So in the first go, that is on the first day, 16th of January, we are planning to have more than 50,000 vaccinations. So we are geared up with the manpower. 16,000 vaccinators are well trained. There is a cold chain which is in place to maintain 2 to 8 degrees temperature of the vaccine.
You're saying all the centers are equally prepared with cold storage centers, qualified vaccinators presumably, but this is not just true presumably of Mumbai, Pune, but across Maharashtra. I'm told in Jalgaon, which has been badly affected in rural Maharashtra, there also the vaccination drive will take place. So this is going to be across the rural-urban divide in Maharashtra, am I correct?
You see, we are now at first for the health, all Karmachari, those for them, we are having vaccination only in the district places and the sub-district places. Actually, we are not going to the remotest, that is the PSCs and the sub-centers. Those are 1,800 and 4,000 in numbers. We are not going in those areas. But of course, we for the health workers, the numbers are 8 lakhs, which were updated on the COVID app, and we are planning to finish it off within a span of 2.5 months to 3 months maximum. So
2.5.
It's not that we are in very much hurry.
Okay, so within 2.5 to 3 months, you will complete this first phase. I want to come to you, Mr. Radhakrishnan. The 2 vaccines, your Health Secretary, Tamil Nadu, the 2 vaccines are relatively new. There has been unease expressed in some quarters over it, but is there enthusiasm that you sense among health workers, among those who, particularly government health workers, are they fully on board to take the vaccine come tomorrow?
See, in all these things, we'll have to wait till tomorrow, but I can assure you that 4.89 lakh health workers have registered. Initially, we have started only with these 166 centers. Definitely, a bit of anxiety will be there, but a lot of prominent doctors have registered that, they would be, who are very popular and very famous doctors, they have registered, and a few of them are also taking this Covaxin, some of them are taking Covishield. So they all are going to build the confidence among a set of people who are likely to have doubts, but by and large, the people who have agreed to come tomorrow are all aware of the vaccination and are waiting for the vaccine. It's a very important milestone. So these are small issues. I'm sure over a period of time, I think all the remaining also should be getting covered.
You know, it's interesting that, of course, this first round is taking place through allotments of whether you get Covishield or Covaxin. Now, Tamil Nadu has been allotted both Covishield and Covaxin. Are you following any strategy to ensure there are enough doses, Mr. Radhakrishnan, particularly for the second shot? Because there are some experts who are worried about supply being a challenge at times in some states.
See, strategically, even though we are very confident and sure that Government of India will be, in phased manner supplying additional doses of vaccine, we have got roughly 5,35,000 doses of, 36,500 doses of Covishield and 20,000 doses of Covaxin. We are planning to initially, limit the number to 2,25,000 odd people together, so that we are having the second dose also ready. But we have been assured that the additional, this only the first tranche will be getting the additional tranches, but as and when we get the additional tranches, it will keep getting expanded, this vaccination. So now it's only focused on the healthcare workers. The frontline workers have time till 25th to register.
Okay. Well, all I can say is I wish Satyendra Jain, Mr. Tope, Mr. Radhakrishnan, all the health ministers across the country, the very best. I know that all of you have a big challenge come tomorrow to ensure that the process goes smoothly. We wish you all the very best for V-Day. Thank you very much.